Well, we certainly had some good news yesterday morning. Moderna, with their drug trials proceeding very well, with 95%. Pfizer the week before. So that's very, very good news. Help is truly on the way for us in Ohio and across the country. So very, very, very good news. The bad news is that our situation in Ohio is deteriorating. We see more and more cases, more and more people in the hospital, and we've got to turn this thing around. We literally have to build a bridge to get from here to the point when we're going to have the immunity from the vaccine. So we got to get over this. We got to get over this bad spot. And I'm going to talk today about some of the things that we can do. And it sounds like the reports I'm getting around Ohio, we're already starting to do that. More and more people are wearing masks in retail outlets, which is just great news. So let's, Eric is back. Good to see you, Eric. Let's take a look at the numbers. Let's go to today's slide. 7,000 cases. This has been running between 7,000 and 8,000 for about a week. 6 weeks ago, we were at about 1,000, so it's gone up dramatically. Number of deaths sadly at 30. Hospitalizations way up, 368. We'll talk about hospitalizations in a moment. Those people in the hospital. 21-day average was 210, and ICU admissions is up a little bit as well. Let's talk a little bit about hospitalization. October 13th, we had 1,000 people in our hospitals in Ohio who had COVID. November 5th, that number was 2,000. By November 12th, that number had gone from 2,000 to 3,000. And you look at today's number, 3,648. So this is just, as you can tell, going up dramatically. You'll see that the yellow is the ICU, and that's going up certainly as well. And you'll see COVID positive hospitalized is the purple. So just a dramatic change. I spent yesterday traveling around in some of the southeastern parts of the state, as well as the northwestern part of Ohio. I had doctors with me at each stop, and each one of them described what they were seeing in their local hospital. Let's the ICU. Let me give you the ICU numbers. 1 month ago, we had 280 of our fellow Ohioans in ICU. Today, we have 900. So a dramatic increase of those in that situation. So Eric, let's take a look at the next one. This is our slide. Of course, 88 counties ranked by highest occurrence, and again, as you'll see, every single county is now a high incidence. And these numbers continue to go up even for the counties that have the least spread. If we look here, Meigs County, for example, still these are high numbers. Every county in the state is at least 2 times the high incident level set by the CDC. Eric, let's look at the top 20. And if you look at the top 20, these are astronomical numbers. If you look at the top 5, Putnam, Mercer, Allen, Lake, Auglaize, these numbers are just shocking. It means that 1 out of 100 people in the last 2 weeks was diagnosed with COVID. So just think about the odds, and we know that's always lower than not everybody's diagnosed, not everyone has the test. And so what that means is that dramatically increases the chance of someone in those counties running into somebody who does in fact have the COVID. And again, it's the reason for the mask, it's the reason for the distancing. All right, Eric, let's take a look at the next slide. This is something we've shown before. I believe this is cases versus testing. This shows we're very happy to see the testing going up, and it continues to go up. But number of cases is going up obviously much more dramatically. So we have some people who think that the increase in testing is what's causing the increase in cases. Yeah, a little bit of it, but most of it is more and more cases. So let's take a look at the next slide, Eric. So this is number again, tests performed, and you can see these numbers are going way, way up. We're happy, certainly happy about that. And the positivity number, the 7-day running average is 12.8 positivity. The last day was 13.8. So certainly not heading in the right direction.